April 26, 1986, the worst nuclear accident in history occurred when a reactor exploded at the Chernobyl nuclear power plant in the Ukraine, releasing 90 times the radioactivity of the atomic bombs dropped on Hiroshima and Nagasaki. An explosion and fire released large quantities of radioactive particles into the atmosphere, which spread over much of the western USSR and Europe. The Chernobyl disaster is widely considered to have been the worst nuclear power plant accident in history, and is one of only two classified as a Level 7 event on the International Nuclear Event Scale, the other being the Fukushima nuclear disaster in 2011. The official Soviet casualty count of 31 deaths has been disputed, and long-term effects such as cancers and deformities are still being accounted for. The disaster began during a systems test on Saturday, April 26, 1986, at reactor number 4 of the Chernobyl plant. There was a sudden and unexpected power surge, and when an emergency shutdown was attempted, an exponentially larger spike in power output occurred, which led to a reactor vessel rupture and a series of steamed explosions. The resulting fire sent a plume of highly radioactive fallout into the atmosphere. Individual doses were far higher than the global mean among those exposed, including 530,000 local recovery workers who on average an effective dose equivalent to an extra 50 years of typical natural background radiation exposure. In the aftermath of the accident, 237 people suffered from acute radiation sickness, of whom 31 died within the first 3 months, 9 children who have died from thyroid cancer, and a future predicted total of 3,940 deaths from radiation-induced cancer and leukemia. Most of the victims were fire and rescue workers trying to bring the accident under control, who were not fully aware of how dangerous the exposure to radiation in the smoke was. A report was published by Chernobyl Forum in 2005 that revealed thyroid cancer among children to be one of the main health impacts from the Chernobyl accident. During the first 10 years of the Chernobyl disaster, the incidence of thyroid cancer increased in the regions of Belarus, Ukraine, and Russia, where the heaviest radioactive iodine contamination occurred. Thyroid cancer has been the most pronounced health effect of the radiation accident. More than 700 cases of thyroid cancer were diagnosed in children residing in these areas. Also, based on a linear, non-threshold model of radiation-induced damage, the Union of Concerned Scientists estimates that among the hundreds of millions of people living in the broader geographical areas, there will be 50,000 excess cancer cases, resulting in 25,000 excess cancer deaths. Our radiation protection book states human beings who receive whole-body doses in excess of 500 rad may die within 30 to 60 days. After the explosion, the exposure levels at the vicinity of the reactor core were in excess of 30,000 Rankins per hour. Throughout the European continent, in nations where abortion is legal, many requests for induced abortions of otherwise normal pregnancies were obtained out of fears from radiation from Chernobyl. The Chernobyl reactor is now enclosed in a large concrete sarcophagus, which was built quickly to allow continuing operation of the other reactors at the plant. Some 200 tons of highly radioactive material remains deep within it and poses an environmental hazard until it is better